Hi, my name is John Flett. I'm a pediatrician who has a special interest in helping children, families, teachers who deal with children who think and learn differently. I've been getting quite a few questions about different medications. The last week, I've had questions about, do I use Vyvanse? What is Vyvanse in the treatment of ADHD? Some teachers are asking about, the short-acting Ritalin versus the long-acting Ritalin. Which is more effective? Is CONCERTA a better medicine? Often, a lot of people like the sound of CONCERTA because it doesn't sound like Ritalin. There are lots of generics in South Africa related to Ritalin as well as CONCERTA. So I'm going to talk about the three of them. And remember, this is not meant to be any advice on treatment, and it's not meant to give you a kind of a direct kind of advice on what you should and shouldn't do. You need to see your doctor who understands these problems. It's not every doctor that understands these medications as well. So get somebody who's really experienced, who deals with lots and lots of patients who have problems with ADHD. And remember, all these medicines are registered for the treatment of ADHD. A lot of people, a lot of parents say, my child's got a concentration problem. Almost having difficulty even mentioning the word ADD or ADHD. Because you can't treat concentration. You can only treat ADHD. So you've got to have a proper diagnosis by somebody who understands that. So what is the difference between all these medicines? There's some similarities. First of all, they're all stimulants. They are all Schedule 6 drugs. Stimulants are drugs that cause the alertness. They are something that cause potentially in some people addiction. Fortunately, all these medicines don't really cause any kind of abuse potential, but they potentially can. So that's why they are highly controlled. And they have to be given with a script every single month. You can't give more than 1 month's supply at a time to prevent the abuse potential. So let's talk about Vyvanse. It's the new kid on the block. It is recently been registered in South Africa. And what is it all about? It is different from Ritalin and Concerta because it's the one that is something called a dexamphetamine. It is a medication which is called a prodrug. It's a smart drug. It only gets activated in your gut and in your blood. So it can't really be abused. You can't shoot it into your veins. You can't sniff it. So in that way, it has less abuse potential. But it's a different class of medication. It is a medicine that has like a double punch. It releases dopamine as well as noradrenaline in a bigger way than does Ritalin and Concerta. So Ritalin and Concerta are similar in that they have the same chemical called methylphenidate. So Vyvanse is different. Now, is it better or not? One thing I would say, if your child is well controlled on Ritalin or Concerta or the generics or the clone, remember a clone is an identical twin, just with a different name. Like Nucon Oros and Concerta, they're clones. Then they're generics. There's Contramol, and then there's several other generics. Those are like fraternal twins, and they're different. So Ritalin and Concerta have got the same ingredient, but they're released differently. Let's start off with Ritalin. Ritalin can come in a pill, very small dose, 10 milligrams, short-acting, boom. Ritalin tends to kind of get control of the kind of symptoms like getting hold of your shirt collar like this, boom, holding it and then releasing. It works quickly and it works out quickly. It comes in short-acting, comes in a tablet that can be crushed. It comes in capsules, which you can take the powder out for children who can't swallow. Big advantage. That's why I tend to use Ritalin in smaller children, because you can titrate it, you can use smaller doses, you can take the powder out, you can put it on a spoon, it's easy to swallow. However, it works very quickly. And also it doesn't last as long, even the long acting, for about 6 to 8 hours. So if you're giving it at 7 in the morning, by 3 o'clock, it's gone, the long acting. And you've got to give extra doses. CONCERTA is more of a smoother increase and a smoother decrease. And it can't be broken. You've got to swallow it whole. And of course, it starts at a much higher dose, 18 milligrams, versus Ritalin 10 milligrams. And it tends to sort of last longer. It doesn't go up as quickly. And in those small children who need short, sharp focus, it doesn't seem to work as well, in my opinion. The older you get, CONCERTA comes into its own. So the less impulsive, the older a child is, they can start to swallow, then it becomes great. So in adults and teens, fantastic. And of course, it comes in at 18, 27, 36, and 54. Sometimes we even have to combine a 54 and an 18 together to get the control. So CONCERTA is something you can't really break. I've had experiences where some of the patients, unfortunately, have tried to cut the tablet in half, and it's released the entire dose, caused heart palpitations, huge side effects. And then, of course, we've got Vyvanse. Now, Vyvanse in South Africa comes in only 3 doses. Elsewhere in the world, it comes in a chewable tablet, which would be really great if we could. Elsewhere in the world, Ritalin comes in a patch even, where you can kind of put it on your leg, and a child gets absorbed slowly. We don't have those. But Vyvanse comes in 3 tablets. One is a 30, a 50, and a 70 milligram. So the entry level is very high. You can't really use it on small children. Vyvanse, there was a study conducted recently which looked at and compared Vyvanse to CONCERTA. And they compared the two, and there was actually a slight advantage using Vyvanse, particularly in those older category children. In the younger children, in my opinion, CONCERTA works a bit better, but the teens and older children, as they get to teens and adults, Vyvanse has a kind of an advantage. Now, one of the things one should think about is if you're having to use CONCERTA and you have to use a 54 milligram and an 18 together, then I tend to consider the Vyvanse, because then you only need 1 tablet. Medical aids and funders tend to pay for CONCERTA, but a lot of them won't pay for Vyvanse. That's a bit of a problem at the moment that you need to consider, and it's quite expensive. The Vyvanse entry level is very, very high. So those are things you need to kind of consider when you have a child or a teen with ADHD. There's this sort of feeling that, the CONCERTA or the medicine's not working too well. Maybe the Vyvanse is just my answer. I'd like to guard against that, because it's not necessarily the medication that's the problem. There are lots of other factors to ADHD. The medication is just one dimension to the problem. So when you think about these medicines and which one to use, don't just jump ship or jump onto a different horse in a different lane just because the one's not working as well. It needs to be optimized, needs to be kind of titrated, needs to be manipulated together with everything. Remember, medication is a very small part of the holistic approach to children with ADHD. So I hope you have a better insight into which one is better. I don't think anyone is better. For different ages, they have their own role. And of course, children who can't swallow medicine, you kind of limit your options. And of course, children that can swallow medication and a bit older, it's more convenient taking something that lasts longer. CONCERTA lasts for about 6 to 8 hours. Vyvanse, we're talking 13 hours. Some studies look at CONCERTA lasting about 12 hours. I don't think it lasts quite as long as that. I'd say probably 10 to 11 hours. And of course, long-acting Ritalin, probably 6 to 8 hours. So all of these can cause sleeping problems. They can all cause motor tics, Tourette's. It's not like one will cause and the one won't. One thing that Vyvanse can do is cause a dry mouth, where Ritalin and Concerta doesn't cause those problems. They all cause lack of appetite. Vyvanse has actually been registered for binge eating. So that's one of the things that it can treat that Concerta and Ritalin can't. The older kids at high school, a lot of the teachers and psychologists are talking about Vyvanse, is it better? It'll just solve all the problems. You can't swallow a drug and solve your problem. There are lots of other issues. Rather look at those other issues. Sometimes just a medication seems so simple. Just swallow it and all my problems go away. So we've got to look at every aspect. And the medicine's only one dimension. So I hope that helps you understand these three drugs better.